Hello everybody, this is TJ Smith and today I'll be administering an intramuscular injection. I'm going to do my 3 checks. I'm going to do my 3rd check at the bedside and I'm going to know my living rights. I'm going to gather my supplies, know my actions, and check for appropriateness. So the sites, I'm going to start by going over the sites. You got your deltoid, which is right here. You put your 3 fingers on your chromium process and inject right below your ring finger. Then you got your vastus lateralis. You can divide your leg into 3 sections, or your thigh, and then you're going to inject right in the middle section. Then you got your ventral gluteal. So you're going to put your palm in your greater trochanter like this, and then your finger on your middle finger is going to be along with your iliac crest. And then you're going to inject in between your middle finger and your pointer finger. So those are your sites there. So there's some different injection dosage ranges too. You can do 2 mLs in your delt, and then you can do 5 mLs in those other 2 sites. And this will be injected at a 90-degree angle. And then this needle right here can be anywhere between 5/8 to 1.5 inches. And then today I got me a 22 gauge. And then the gauge size here on this needle can be 20 to 25 gauge needle. So I believe that touches everything there. I got my supplies, I got my med, prep pad, and my needle and syringe. So the order calls for an IM injection, 2 mLs in the delt. So I'm gonna start by approaching the room of the patient. I'm gonna do my general principles and safety practices. I'm gonna perform hand hygiene and let the patient know what I'll be doing. I'm gonna use 2 patient identifiers. Name, date of birth, they stated that, matches up with their name, their band, and I'm gonna check their MRN. Everything matches up there. I believe I'm good to go for the injection. I can check here and make sure my drug is not expired. And then I'm gonna grab my alcohol pad, go into circular motion on the delt, grab a new prep pad, go into circular motion on the vial, let those dry. I'm gonna don my gloves, and then I'm gonna get my syringe. Okay, so I got my gloves on at this point. I got my needle here, got my vial. I'll go into the vial here, and I'm gonna draw up 2 mLs. I'll drop a little bit more just to get the air out. Okay, get all that air out. Got my 2 mLs here. There's no air or bubbles in the syringe present. Now I'm going to use the Z-track method to administer this injection at the delt. If I can't find a delt, I'll do the same thing. I'll do the 3 fingers on the chromium process and then inject below the ring finger. So I know where that delt's at, so I'm going to do Z-track method. I'm going to pull that skin back and then inject at a 90-degree angle. I'm going to inject. Good and slow. 10 mLs per second. If I wanted to go that slow at that rate, I pull my needle out and I'm going to let the skin back, let that Z-track work. I'm going to trigger my safety. I'm going to recap my needle because I want to keep it. there. Gonna practice my GSP. Gonna make sure the patient is comfortable after injection. I'm gonna take the drug with me because I won't leave it at the bedside. I'm gonna doff my gloves, perform hand hygiene when leaving the room, and I'm gonna document, record what I just administered, 2 mLs in the delt, and then I'm gonna check the patient's response to the drug, make sure there's no adverse effects present. Then I'll go into the room, check for that, no adverse effects present. Patient seems to be doing fine after injection. I'm gonna exit the room, perform hand hygiene, and that is how you administer an IM injection.